Miss Kimberly, I'm Dr. Delicio. Nice to meet you. What happened?
Oh, I was at gymnastics practice and I was doing the vault and I went up on the vault and then my hand slipped and I put it out and I fell and something like went terribly wrong.
Okay, well, we'll take real good care of you. What happened after you fell?
Well, my trainer like rushed over. There was blood everywhere. He called the paramedics and they put a wrap around my arm, but my elbow hurts really bad.
Okay, so if you could point, where is your pain right now?
Well, I have pain where the blood's coming from, and then here on my elbow, and my hand feels funny, and I don't know what's wrong with that.
Okay, well, we're going to take a good look at your arm and examine you right now and figure out how to get you better. Well, the first thing we're going to do is examine your arm.
Okay.
So I'm going to put on my gloves and then we're going to very carefully take off that bandage. All right, so we're going to be real careful. I'm going to stabilize your arm here and this should come off.
I don't even want to look at it.
I know, you're going to do great. All right. Okay, are you okay?
Yeah, it hurts.
All right. Well, so we're going to be real careful with that. It's always important to take off a dressing whenever anybody comes in because you have to examine your arm as the treating physician first to make sure that there's nothing going on. As you can see here, you have a wound in your skin, and you don't have to look if you don't want to.
Okay.
But there is a wound there, and that is concerning, but we'll figure out what's going on.
Okay. What's next?
So after we inspect your arm, the next thing we do is assess range of motion. Now, you're probably too tender here where I can't move your arm and I won't do that right now. But normally I'd want a good assessment of your shoulder and elbow range of motion.
Okay.
So after we do an inspection, then we do a sensory exam and we want to make sure everything's working. So can you feel me touch you right here? Mm-hmm. This is your axillary nerve and that looks like it's working okay. Can you feel me right here?
Yeah.
That's your lateral antebrachial cutaneous nerve, and that looks like it's going okay. So I'm going to take your arm real carefully like here to get to your hand. And I know it hurts when we move your arm. What about right here on your little finger? Can you feel me touch you right here?
Yeah.
Okay, that's your ulnar nerve, and sensation there appears to be intact. What about here in your index finger and your thumb? Can you feel me here? Does this feel normal?
Yeah.
Okay. What about right here on the back of your hand? Does that feel normal?
No, that feels weird.
That feels weird?
Yeah.
Can you feel me touch you here at all?
A little bit, but it's like it's goofy.
Okay, so we're going to rest your arm here real carefully. So sometimes when people can't feel right, sometimes they'll feel pressure, but in order to tell if that nerve is working or not, sometimes we assess whether you can differentiate sharp sensation. And so what we do is we very carefully use a needle here. And so let me know if you could feel this at all.
Okay.
All right. Can you feel me right here?
No.
So after we inspect the extremity and the wound, we assess range of motion, which we were not able to do in this case. We start with our neurologic exam, which we did the sensory portion, and the next step is the motor exam. So the first thing that I would have you do is move your shoulder or elbow, but because that looks so painful, we won't have you do that right now. Can you wiggle your fingers at all? Okay, a little bit. It appears that something is not normal with the way you're moving your fingers, so the next thing we do is move to a dedicated hand exam or a dedicated neurologic exam of the hand. So can you make the OK sign like this with your fingers? Very good. Now don't let me pull my finger out here. Great. Now that's a test for your median nerve or your anterior interosseous nerve, and that appears to be working well. Can you spread your fingers out real wide? Very good. Now don't let me push your fingers together. Great. Can you cross your fingers like this? Good. Now that's a test of intrinsic strength or ulnar nerve function, and that appears to be working well. Now can you give me a thumbs up real high like this? Okay. And you can't. That doesn't...
No.
Okay. Now don't let me push your thumb down here.
Okay.
Good. Can you resist me at all?
Not really.
Okay. So that's a test for radial nerve function, which is thumb extension, and you're not able to extend your thumb at this time. Now can you raise your fingers up like this and extend your fingers? Good. What about, can you move your wrist back at all? So you're not able to do that
No.
too. So thumb extension, finger extension, as well as wrist extension, that's all radial nerve function, and that does not appear to be working right now. The next step is a vascular exam. We want to make sure your hand is well perfused, or there's good blood flow down to your hand,
Okay.
and that you do not have any kind of vascular injury up in your arm. So that's often done by we blanch or squeeze your fingertip to see if it turns white, and then when we let go, the capillaries, or the little vessels that perfuse or supply blood to your fingertip, it turns red again, indicating that the vascular supply to your hand is intact, and it is. We usually like this to be less than 2 seconds, or when I turn it white and then let go, we like it to turn red again in 2 seconds.
And it's okay.
That looks okay for all your fingers. And then when we want to check the larger vessels, you have a radial artery and an ulnar artery on either side of your hand. And so we could assess your pulse right here. And so I could feel a very, very strong pulse right here on this side.
It's okay.
And that looks okay there. And then when I palpate over here on this side, I feel a very strong ulnar pulse too.
Okay.
So it does appear that your hand is well perfused, or I do not suspect any signs or any vascular injury up in your arm. All right, well, let's summarize everything we know so far. So it appears when you were approaching the vault, you went up, you slipped, and you came down on an outstretched hand, and that's when you felt the pain. We do notice the wound there on your arm, so I would certainly be suspicious at this time, given the amount of pain you're in, that you have a humerus fracture or a humeral shaft fracture.
Now, what's the humerus?
The humerus is your arm bone, what
Okay.
connects your forearm here up to your shoulder, and that would likely explain why you're in so much pain.
Okay.
The main issue here is that you have a wound. Whenever we suspect a fracture, and then there's also a wound, we refer to that as an open fracture. And the concern is that there could be contamination, and that could subsequently become infected. And so our treatment for that, once we get x-rays and confirm that that is the diagnosis, we'd recommend taking you to surgery actually right away, so we could wash that out and minimize the risk of infection.
Will you put a bandage back on it?
We'll wash it out and minimize that chance of infection, and then we'll talk about how to treat it based on the results of your x-rays. Sometimes we could treat these non-operatively, sometimes we could fix these with plates and screws. Other times we could fix these with rods or nails, but that'll depend on the result of your x-ray. The other thing that we found here today are your blood supply to your hand is very good. There does not appear to be any clinical evidence of a vascular injury. However, your radial nerve does not appear to be functioning distal or past the site of injury. Your median and ulnar nerve are, but your radial nerve is not. So when you have a possible fracture in that area, and there is concern that your radial nerve may not be working well. So what we do in this case, if there is a fracture there, that would be an open fracture, and your radial nerve is not working, so we'll explore that at the time of surgery. If there's any injury there, we may repair that at that time. Sometimes the nerve is cut in half, and then we'd have to put that back together. Other time the nerve is just contused or basically bruised. And in those situations, once we confirm that at the time of surgery, we can just watch that, and hopefully your nerve function will come back. But right now we just need more information, so we're going to wrap your arm up real carefully and get that x-ray and probably take you to the operating room today.